Coronary artery disease. What is coronary artery disease? According to Demler and Rhodes, coronary artery disease is the number one cause of death in the United States for men and women. Coronary artery disease develops when major blood vessels become damaged. It usually results from a buildup of plaque in the coronary arteries. Facts about coronary artery disease. Coronary artery disease is the most common type of heart disease, killing 365,914 people in 2017. About 18.2 million adults aged 20 and older have coronary artery disease. About 2 in 10 deaths from coronary artery disease happen in adults less than 65 years old. Assessing for coronary artery disease. Symptoms of coronary artery disease include chest pain, shortness of breath, diaphoresis, nausea, and tachycardia. Modifiable risk factors include tobacco use, hypertension, diabetes, and lack of physical activity. Non-modifiable risk factors are age, sex, and family history of coronary artery disease. Khan conducted a study to understand the knowledge of people in UAE about the signs and symptoms of coronary heart disease. They found that the knowledge of the population is unsatisfactory and many were not aware of signs and symptoms of coronary heart disease. Treatment for coronary heart disease. The long-term goal for treating coronary artery disease is to decrease angina, prevent a future MI. Medications to treat coronary artery disease include beta blockers, calcium channel blockers, and nitrates. And lifestyle changes such as healthier diet, frequent exercise, and quitting smoking can also help treat coronary artery disease. How gender affects coronary artery disease. Coronary artery disease affects both men and women. Coronary artery disease is more common in men than women. The identification of risk factors and the importance of gender difference is important in treating coronary artery disease. They found that a previous MI was the most effective risk factor in females for getting ischemic heart disease. In men, they found that hypertension was the most effective risk factor for getting ischemic heart disease. Cultural and spiritual considerations. As nurses, it is always important to be aware of cultural and spiritual considerations when taking care of patients. For example, there are certain cultures or religions that don't eat certain foods or eat a lot of the same food. Diet is a modifiable risk factor in coronary artery disease. It may be necessary for nurses to identify healthy food choices for patients while adhering to their cultural or spiritual wishes. Nurses often lack quality care because they're not culture aware. They note that this is something that has got better, but is something we still need to improve on in the nursing profession. Preventing or managing coronary artery disease. Unfortunately, there is not a way one can guarantee they will not suffer from this disease. There are ways to decrease the chances of getting it, such as not smoking, eating healthy, and exercising. However, even if you do all the right things, there's still a chance you can get coronary artery disease, especially if there's a family history of heart disease. According to Wang, 40 to 60% of predisposition for coronary artery disease are inherited. Managing coronary artery disease includes taking prescribed medication, lifestyle changes, and monitoring for symptoms as it could be a sign of other serious conditions such as an MI. Conclusion. Coronary artery disease is something that impacts my community tremendously. Living in eastern Kentucky, many people smoke, and we have one of the highest obesity rates in America. However, coronary artery disease is a nationwide problem. We have come so far in treating heart disease in America, but it's something we must continue to improve on.